Hello everyone, I am Dr. Ashish and welcome back to my channel, The Vital Diaries, where we decode the global medical career pathway for doctors. If you are a medical postgraduate from India, especially who has recently completed his MD, MS or DNB and he is wondering about if he can work in UAE, then this video is for you. Let's dive into what you can expect from eligibility to licensing and the real opportunities available even for freshers. First of all, if we talk about UAE it has 7 Emirates like Dubai, Abu Dhabi, Sharjah, Al Quwain, Al Ain, Ras Al Khaimah, Fujairah. As everyone knows that UAE is expanding rapidly and boosting its healthcare. So there is over the period of time to time, there will be requirement for doctors, especially for specialists. Now the basic eligibility to work in UAE. To work in UAE, you should have a recognized postgraduate qualification like MD, MS or DNB. And ideally, you should be 2 to 3 years experience after finishing your residency, either MD, MS or DNB. And then you can apply for a licensing exam which is DHA for Dubai, HAD for Abu Dhabi and MOH for Sharjah. But if you are not experienced, then by 2 to 3 years you are a recent postgraduate, then don't worry, I'll explain. There is an opportunity for you as well. Now the degree recognition. Usually in UAE, they recognize Indian degree MD, MS and DNB. But if you have a diploma of 2 years or some fellowship, then it won't be recognized in UAE. You have to have MD, MS, DNB or a super specialty like DM or MCH. Still, you can check your recognition in Professional Qualification Requirements portal in either of the websites, either DHA, DOH or HAD. Now let's talk about the fresh postgraduates. So the fresh postgraduates, what you can do is you are not eligible to work as a specialist. You need to have an experience of either 2 years to 3 years. But what you can do is, if you really are keen to come to UAE and work, you can apply for a general practitioner license and then start your career in working in UAE. Especially if you are, suppose you are a general surgery resident or you are a pediatric resident or you are an ENT resident, what you can do is there is a post called as senior GP, senior general practitioner or senior medical practitioner, where you can show your special interest in the specific field like ENT or pediatrics, and then you can get hired here as a GP. You can gain your experience for 2 to 3 years and then you can convert your license as a specialist. There are 2 catch in it. If you apply for a general practitioner license, being already a specialist of that field, your probability of getting that job increases. Second thing is, when you are already working in UAE, you get to know the trends, you get the contacts, you get the recommendations. So getting your license converted to a specialist and getting hired as a specialist increases as well. Now, if we talk about what's the process of getting your license or eligibility letter, is first you have to go through the list of documents which is required by the respected Emirates. Then you have to get all your documents verified by the data flow. So data flow is a third party organization or a third party company which has been hired by the Emirates to verify all your documents whether they are right or fake. Okay, so depending upon whatever documents you have, around 8 to 10 documents right from your med school, your experiences, your fellowships, your internships, your residency, your degrees, everything, it usually takes a month to 2 months to get verified. Then you have to apply for either Emirates exam like DHA, MOH or HAD exam, and then you get your eligibility letter. Once you get hired, then your employer will issue a license for you. Now, if we talk about the demand and the salaries, so usually for specialists and GPs, the most demanded specialties are family medicine, internal medicine, pediatrics, radiology, emergency medicine and general surgery. So if you are a fresh postgraduate after finishing a general surgery, you can work here as a GP or a senior GP in general surgery, which increases your chance of getting hired because you are already a specialist in that field. The only 2 flaws with this is you will get the salary of a GP and you have to wait for 3 years working here to get your license converted to specialist. But as I already told you, two positive point is you get to know how the work culture is here, and you get the recommendation letters and contacts, and your chances of making or upgrading your license to specialist increases, and chances of getting hired increases as well. Now, if we talk about getting the GP salary in UAE, it again, in my YouTube video, if you have seen, I have already said it all depends upon either you are working in a clinic, either you are working as a part-time, either you are working as a full-time, either you are working as a medium level hospital, or you are working as in a tertiary hospital. So your salary might range from somewhere around 12,000 to 25 to 30,000. Okay, so your salary as a GP will range from 12,000 to 20,000, 25,000, depends. If you are a specialist, then your salary will range from 20,000 to 40,000, 45,000, depends upon the level or the setup. Okay. Now, in summary, if I have to summarize, if you are a medical professional from India seeking healthcare opportunities or job opportunities in UAE, then for experience, I told you how to go ahead with your documents, with your data flow, with your exam, with your licensing and eligibility letter. For freshers, they can come here as a GP and work as a GP for 2 to 3 years, and then they can upgrade their license as a specialist. So once they upgrade their license as a specialist, their salary increases, their post changes, and they can work as an ENT physician or a general surgeon or a pediatrician, right? If you found this video helpful, please give it a like and subscribe to my channel. Don't forget the Vital Diaries. Okay, thank you.